My mom was an oncology RN my whole life and is still an oncology RN. So I really grew up in an environment where I saw what an impact healthcare workers can have on patients and their families, and I experienced that through my mom. So growing up, I always had the big goal of being a doctor or some type of medical provider, just with the goal of making a difference in people's lives and helping people and kind of leaving them better than how I found them. Also with my interest in science and the human body, it just kind of seemed like the natural fit. And one middle school project, I had to research a healthcare job that I had never heard of before, and my mom told me about the PAs she was working with. So I did this research project on it and got to shadow a few PAs in 8th grade and fell in love with it since, and ever since that's been my path, and I'm excited to be here. My role at Reedsburg Area Medical Center is I'm a PA at the walk-in clinic. There it's kind of like an urgent care setting where we see a variety of acute things that people may not be able to see their primary doctor for, or something that's a little bit more emergent but not requiring an emergency room visit. So there I'm able to see and treat all the patients that come into the clinic. I think the most rewarding thing is just being able to connect with someone in a time of stress or in a time of worry. And my goal is to, obviously help them through it medically, but also just to be there to know that they're being listened to and supported. And I find it important to kind of attack that from all angles, not just from the medicine standpoint, but setting up a follow-up appointment if I feel like they just need a little bit of extra care, or talking about some things they can do at home that aren't medicine related, more lifestyle or health, like through diet or exercise or things like that. Just making it a really good, well-rounded experience so it doesn't just feel to them as if I'm throwing something at them and telling them to do it, but really incorporating their lifestyle and their ways of life into their care at home as well. I chose to work at Reedsburg Area Medical Center because truthfully, as a new grad and as a new PA, it was really a struggle to kind of find an environment where I felt supported and where I felt like I could collaborate with people that have been in the field for a lot longer than me. And that was just something that was really, really important to me, at the top of my list on my job hunt. And the minute I interviewed here and then stepped into the walk-in clinic, I really felt that collaborative nature and really felt supported by everyone, which was huge. It really is just like a very small town, quaint family. It's really great. And then just walking down the halls and seeing all the familiar faces, it's very homey, and it's just a nice place to be, and I do feel supported along the way, so it's been great. When I'm not working here, my husband and I, we really love to spend time outside at Madison and explore the city. We are out on the paddleboard or in the kayak out on the lakes. We also have a boxer, so we like to take her out on good hikes. We also are really big pickleball fans right now, so we're at the pickleball courts quite a bit when I'm off. Just like to walk along the lakes, spend time kayaking or being on the paddleboard, just really getting out and kind of enjoying everything that Madison has to offer. So, exploring coffee shops and restaurants as well. There's just a lot to do, and we really take full advantage of those days off when we're not working.